Hi, my name is Chang. I'm an orthopedic spine surgeon in Northwest Indiana. Today we're going to talk about aspiration techniques using the Isto Biologics equipment. Today we're going to go over percutaneous technique for aspirating from the iliac crest. First thing I want to do is identify the bony landmarks here in the lower spine. The most prominent points are the posterior superior iliac spine, or the PSIS. I've identified this one, and then there's also one on the other side. Doing the percutaneous technique, I first identified the PSIS, and going approximately 2 centimeters proximal to that point along the pelvic brim, I'm able to find the bony landmark. I make a small incision directly over the planned incisional site, and then I place the aspiration needle down to the bone, and then I walk across the rim so I can feel where the outer table is and the inner table is, and then get a sense of where the middle is, and dock down. Now, angulation of the needle is important because the iliac crest angles out at about 40 degrees. So I want to also mimic that angle with the needle, going about 40 degrees in this plane, and then about 40 degrees for vertical, which approximates being perpendicular to the pelvic brim itself. So once I feel I'm in good position, then I'm able to tap into the iliac crest. And I like to place this as deeply as possible. I don't want to go through the cortex, I don't want to injure any local structures, but also I want to maintain a good bony seal around the aspiration needle. So once we're down as deeply as possible, then we take a heparin syringe, place that on the aspiration needle, and then carefully draw back. Now this syringe is very helpful because every 10 millimeters there's a step that you can dock onto a step here, and so it creates a vacuum, so it's able to receive the flow without my having to pull up on it myself. That really decreases a lot of strain on my shoulders. And also, too, it allows for me to concentrate on the speed of the aspiration collection. If it's coming up fast, then I rotate the needle rapidly. And if it's coming up slow, then I go slower. And the reason why we rotate the needle is so that we're able to get equal circumferential collection around the bony insertion site. So once the syringe is completely filled, then I pass this off to my assistant, and then I will redirect the needle. This one is coming at this angle. The next one I will angle more caudad, and if I need to take a third one, then I'll go more cephalad. Basically, I want to create different channels so that I'm collecting from a totally different site. So this one will pull back a little, angle downward, place the needle, and then tap in until you hear the cortex again. And then once again, using the syringe and aspirating until it's full. And if necessary, I'll do a third. Now, once I've collected as much as I need, I want to plug the bony hole using little pieces of gel foam infused with thrombin. So there are little pieces that I will place into the aspiration needle, and then using the blunt trocar this time, push that down all the way to the end of the tip of the needle. Pull back about halfway, and I'll do that again. Put some gel foam pieces and then push down. And so that creates two areas of hemostatic blockage, prevent any blood flow. And I found that to be successful in help preventing any bleeding problems from this technique. We'll remove the needle. Since this is a percutaneous incision, we'll have to close that with a stitch. Later we'll talk about how I can approach it as a part of a spinal procedure where I don't have to make a separate skin incision.